Here we go, students. Hyperpituitaryism number 3. This time the focus will be on nursing care. And we want to remember when we're talking about hyperpituitaryism, again, we have the adult component, which is acromegaly, and then we have the early onset, childhood, early teens of giganticism. And let's turn over here and talk about that. If we can just remind you with giganticism, that will present itself before the epiphyseal plate closes. Now look at this bone, long. So if we could just, in simplification, remember gigantism? Hey, long bones, which will reflect in very tall and giganticism. There you go. This would be a normal bone. But when we talk about acromegaly, the adult onset, the epiphyseal plate is closed. Therefore, the bones are still going to grow under the influence of excessive growth hormone, but they won't grow longitudinally. They'll grow wider and thicker, and hence they give physical disfigurement with the acromegaly. Now, with acromegaly, with giganticism, the patient needs to know, a reality check, if you will. They need to know what can change and what will not be able to change. And that's a science in and of itself. There you go. The first part of nursing, as you know, remember the nursing process, ADPI, assessment, diagnosis, planning, implementation, evaluation. Well, what are some things that we're going to assess with the patient with acromegaly or giganticism? Remember we talked about energy level earlier. And energy level at the initiation or the early onset of the disease of hyperpituitaryism, they have a surge of energy. However, as the disease progresses, then they tend to be plagued with fatigue, decreasing energy level. And we're going to want to continually assess that. All right, we know that there'll be physical changes. In giganticism, it speaks for itself. We're talking about people that are 8 feet tall or 300 pounds. And for acromegaly, we're talking about distortion. We're talking about the jaw that's going to come forward, and the vertebra changing, and the hands getting larger, and other physical changes. We also know that the optic nerve is near the pituitary gland, and this disease of hyperpituitarism can affect the optic nerve. Therefore, visual acuity, the ability to see sharply, can be impaired. And then voice quality. One of the things that happens with hyperpituitaryism is the enlargement of the organs, organomegaly. And when it affects the organs that deal with speech, the speech quality might change. One thing I did not put up here, but the emotional tone. This must be a devastating experience for the client, for the patient, and for their family. Now, we deal with nursing diagnoses to organize our strategy in taking care of this patient. And we're going to narrow it down to 4 nursing diagnoses. 1, disturbed body image. 2, chronic pain. 3, ineffective therapeutic regimen. 4, activity intolerance. Let's first look at disturbed body image. Disturbed body image related to physical changes as evidenced by patients stating, "I look terrible." It may not be as obvious as that. They may not want to look at themselves in the mirror. It might be very subtle manifestation. And we cue into that. But disturbed body image. And what we want to be able to do with this patient is first get them to talk. Allow them to express themselves. In nursing, when we have a patient expressing themselves, how they feel, more particularly, we're involved in something that's very therapeutic. Therapeutic communications. If we can get them to speak about how they feel, something good is occurring. We want to encourage the patient to pay attention to grooming. And sometimes when we don't feel well, we just want to give up. But hey, encourage them to comb their hair and simple grooming things. And lastly, there may be a time when it is pretty severe and they're going to need help beyond our capacities, and so a mental health referral may be needed. will know that they're doing okay when they're able to verbalize an acceptance of their situation. Let's say it was me. This teacher's 53 years old, and let's say I had acromegaly. And I said, well, listen, I'm not too pleased with the way I look. However, I love teaching, and that means more to me. And as soon as the students maybe get over the way I look, I'll continue with my life and find it meaningful. It might be different for different people, okay? But feelings of acceptance. Never underestimate the ability of the human to accept their situation. All right, nursing diagnosis of chronic pain. Headaches can be a problem, and then musculoskeletal overgrowth. That can cause some pain. Okay, so here we have the diagnosis again, chronic pain related to headache, and I put MS, overgrowth, musculoskeletal, as evidenced by patients saying, hey, my head hurts, or they got joint pains, or maybe bone ache. Always remember, students, there's 3 components to an actual nursing diagnosis: problem, etiology, signs and symptoms. Okay, what are some of the things we can do for pain management? Let's get those endorphins out. Let's try and alleviate the pain. We can treat it with the medications, analgesics, and that will need a doctor's orders, and we want to be careful to implement that. And we want to be careful to document responses to the pain and get a number scale in there. Imagery, I have found myself, and I'm sure you have, when you talk about pleasant things or think about pleasant things, you start to feel better. And sometimes with certain people, maybe talking about their family, getting them to just talk about things that they enjoy, that may help them. Massage, that's also good. Now, we'll know that they're doing better when we see a relaxed facial expression. We as nurses should be able to read faces to a certain degree anyways. We can't always be perfect on this, but you can see a face at times that just shows pain. And some of these people, they may not talk to you about it, but there are other times when we're going to see that we know that the pain is working, the pain interventions are working, and they'll be able to verbalize it and say something like, hey, I feel a lot better. That's wonderful. Ineffective therapeutic regimen as related to lack of knowledge is evidenced by patient double dosing their medication, or they have questions about the treatment. There's certain signs that show they really don't know what's going on, at least to a certain degree. And any ignorant patient, I don't mean ignorant in a condescending way, I mean not knowing. When a patient doesn't know, that's a call of action for us as nurses to make sure the patient has adequate understanding of their disease and what they're supposed to do in regards to that. So education is going to be biggie, educating them on their medications, which means we have to know them. And these are not very easy medications to explain and to understand, but we can do it. Pre-op, some patients are going to have surgery, and we have to get them ready and let them know what the surgery is about, and post-op what they can expect afterwards. We'll know we achieved our goal here when they're able to follow the regimen safely and even explain the disease process and all. And you know what? While they're explaining, we should see a sense of confidence in them. All right, lastly, I want to talk about activity intolerance. Do you, perhaps after studying a great deal for nursing, getting ready for a test, and you're just exhausted. You don't really want to do anything else, and every little thing seems difficult. That's what it's like when you're fatigued. Here we have activity intolerance related to fatigue, as evidenced by patient not attempting self-initiating activities. Well, what do we mean by that? Maybe they don't want to brush their teeth, just exhausted. Well, what we want to do with this patient is keep them free from excessive tiredness. And you know what? It'd be nice if they have a sense of achievement, that they are getting things done. Well, how do we achieve that? We might have a workable schedule. Not an overwhelming schedule, but a schedule where they can get the things done that they want to do, that they consider meaningful. And after they achieve those things, do them, we'd like to see a sense of achievement. We have to balance it all out with what? Rest periods. So, workable schedule, achieve the meaningful task, and they should be free from excessive tiredness. Again, these are the nursing interventions that will be involved with hyperpituitaryism. Thank you.